Time now for another edition of Wellness Wednesday with Dr. Bradley Meyer from the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Hey, good morning, Dave. Good morning, everybody.
Well, you have a special guest with you today.
Absolutely. I'm bringing back Mychal Sheridan. Time flies. We had him back on several months ago, maybe last spring, last winter, and he's a valuable member of the team here, and it's just a nice chance to be able to occasionally showcase not only what we do here with all the different treatments and modalities, but who the different pieces of the puzzle are, because it is certainly not just me here. It is. I've got an incredible team that I'm blessed with, and we all work together. We're working on how do we make things better, how do we get the body back into balance, and specifically brain. I talk a lot about brain power, brain fog, brain fatigue. And a lot of times we talk about pain, brain and pain. And so what can we do? There's lots we can do. We don't always have to feel that, this is part of aging. This chronological thing is catching up with me. There is so much we can do because, as we know, and there's a lot of stuff in the news right now, there's a lot of stuff out there that are environmental toxins that have a big impact on our body's ability to find balance and to decrease inflammation. So anything and everything we can do from a modality perspective, whether that's hyperbarics, that's ozone therapy, that's our IASIS neurofeedback, brain gauge, nutrition, so much more. What can we do to bring that body back into balance? We can do it when we are working to eliminate as many of those stressors on the body. But when we have somebody that has had special training in body mechanics and in the brain, and I always think one of the toughest things for me to work with is insomnia on folks, and Mychal's done quite a bit of work with insomnia. He did come from down in central Iowa where he had a really good practice before he moved up here with his wife, and but he did a lot with neurodegenerative disease, including Parkinson's, gait, mobility. So I've got Mychal here with me, and I just want him to share more about how he can help. One last thing, I had a guy, we've been doing ozone injections on him, prolozone, and he comes from Minnesota area, southern Minnesota, and he's had this mid-back pain for 30 years. And so he also has developed some neck pain. He's developed, and this was post-motor vehicle accident, developed some numbness and tingling in his hands, almost like some carpal tunnel type symptoms. So we did IV ozone and ozone injections along his cervical spine and in his carpal tunnel region, and IV ozone. Dramatic improvement, but I tried his mid-back with prolozone ozone injections, which is supercharged oxygen, and we were still not moving the ball with him. So I said, Mychal, let's have you see Mychal and see what he can do with you to work on some things that mechanically might help. So he had one session with Mychal, and the pain that he had there for 30 years left him, and so we're still working on building that up to maintain that. But that just goes to show the power of the team and many tools. So I got Mychal here, Dave.
All right, Mychal, thanks for coming aboard here this morning. So let's talk about this patient first. What did you have to deal with that particular patient, and how did you get some results?
Yeah, good morning, Dave. So this patient, first let's break into how the brain operates from a feeding pattern. The brain kind of, they're on start from the bottom to top, back to front. And the bottom parts of the brain are your midbrain and your cerebellum. So I started assessing his cerebellum with certain tests, which aren't hard. They take like 2 to 5 minutes, and it let me know that his right cerebellum isn't functioning as optimal as his left cerebellum. And what that tells me, this patient needs more right side stimulus than the left side. So we're approaching the body from the right side mostly in this session. And then other ways to kind of help that is through the midbrain. So the midbrain is where our cranial nerves are located at. And you have three parts of the midbrain: the medulla, pons, and the brainstem is at the top there. And usually with motor accidents, either the pons, where the cranial nerve 8, where our vestibular nerve is located, gets out of whack because of that collision, or the brainstem, where the eyes are at, is at the top, can also get out of whack. So assessing those let me know to work with his eyes more than anything. And we were just doing some vision drills to kind of retrain the eyes that movement is okay instead of feeling in that fight or flight mode. And then once we kind of got movement is okay, then we could get on to some more hands-on stuff and kind of work that mid-back, neck, and even in the jaw a little bit.
Wow, that's pretty incredible. And this patient had 30 years worth of pain and discomfort.
Yeah, Dave, I think what's pretty interesting about this is that a lot of times when we think about body mechanics and pain, we think we're going to go in there right where the pain's at. Mm-hmm. And that was his mid-back. And that's where I've been concentrating with the prolozone injections, which, as we talked last week, we want to increase circulation in the areas where there is pain. But there develops a pattern when there's an injury. And that pattern, it develops into there's plasticity. There's plasticity that becomes hardwired eventually, and it turns into a pattern. And so this is the cool part, if you're working on the brain, which Michael did, he focused, that's just an interesting approach to say, okay, he's got mid-back pain, and it's on that, was it the right or left side?
The right side.
Yeah, it was on the right side. Looking at the brain was a key, and some of that hardwired pathway from that pain to breaking that loop. He was kind of stuck in a loop. And so we increased the circulation. So I kind of work things at a molecular level where I'm increasing food to that injured tissue with supercharged oxygen, ozone in this case, and some other B vitamins and such with our prolozone. But then Michael goes in and works in tandem on this neurologic pathway in the brain. So again, a lot of times when you think about, okay, my back hurts, I'm going to go get it adjusted. Well, Michael can work on that area as well. But again, what makes him unique is that he's bringing in the brain factor. And that's where we can accomplish really, really big things, because we always talk about the gut-brain connection, but everything that we do, our body's got a memory of it, and that's where Michael's working.
All right, now we don't have a lot of time left. I want to get on to insomnia. So, Michael, how are you helping people with insomnia?
Yeah, so insomnia, usually, first of all, that's a very habitual pattern, and creating change with that is kind of trying to take breath work into it. So easy breath work to kind of calm the body down is our typical box breathing. So we could do a 4-second inhale, 4-second pause, 4-second exhale, and then a 4-second pause. Navy SEALs train this all the time. It changes our sympathetic state into that parasympathetic state and get us into that rest and digest state. And with that, we're slowly changing that pattern where people kind of get in that loop, like Dr. Meyer said, where I can't fall asleep. So what we're focusing is on a different input of, hey, let's focus on your breath for 2 to 5 minutes. Usually by the end of the 5 minutes, they're passed out. And over time, we can kind of retrain that habit.
Okay, so that's kind of...
So, Dave, When we work together, this is why it's such a blessing, because sometimes we'll run into where we feel like we're stubbing our toe a little bit or not making progress. Then we try another approach, and a lot of times the brain gauge, which is an incredible modality that works on those nerve pathways, as well as our eye-assist neurofeedback. Then you throw in Mychal and his giftings and techniques. All of these areas together, it's from something that can be a very difficult thing to treat when it gets in that chronic habitual state. But the inspiring thing to me is sometimes some of the most basic things can make the biggest differences. And we've talked about that, Dave, over time with folks that come into the clinic that maybe aren't quite ready to do IV ozone yet or some of the other things, but we're just talking about detoxing the body and lifestyle pattern changes that if we can educate you on some of these things, there can be big impactful changes in your quality of life. Whether or not you want to go the full bore and do all the different things through the clinic, or you want to stay a little bit more basic and approach that the body has an incredible capacity to heal. We just have to give it the right information, and then it's going to work on that pathway.
So, Mychal, I want to talk a little bit more about this breathing and the technique that you use, and especially breaking the pattern of somebody that has breathed this way for, let's say, 60 years of their life. How do you break that pattern that somebody is not breathing from their diaphragm? And somebody has been a shallow breather for their whole life. How do you break that pattern?
That's where I bring on some hands-on techniques. I do a technique called the diaphragm reset. And with that we're just really training on the diaphragm. It's a technique that I've seen really good results with. And then just trying to get a lot of sensory input to that area before we train it can make a big difference. Because how the brain works, your sensory part of the brain is before the motor part of the brain. So if we can provide good sensory input to the diaphragm area, it can make a big difference, and then kind of getting that pattern down.
All right. Well, we're going to have to go here, but I know that's incredible work that you're doing. But I know that breathing, how a person breathes, can affect just an enormous amount of different things, from athletes to people who are suffering with stress or anxiety, and on it goes. So it's a pretty big deal.
I'm learning from Mychal as we go here too, so it's cool. He's bringing his giftings in, and it's creating these patterns, and like anything, even with me, I was looking back at my pictures. November already is my 1 year of doing kettlebell training, so it's creating a pattern and repetition of these good habits. But if then our body's got this memory, and we start going down this road to recovery and ultimate living our best. So I think if people really are interested in, because Mychal he's become a part of one of my incredible blessing offerings. But if folks are saying, hey, I've got some insomnia, I've got some pain, I've got some problems with my gait, you can just call the clinic to get in with Mychal. And now if you want to take a big picture focus beyond and start with seeing me, and where I look at things at more of a molecular level, and trying to put the whole picture together in the different pieces, you can start that way as well. But it's certainly just fine to get right in and make an appointment with Mychal for what we call the orthopedic massage, and then his brain work that he is focusing in, and then he works with me and say, maybe this individual could use a little bit of ozone therapy or some hyperbarics or some neurofeedback or brain gauge. So there's a lot of different ways to start here and get going and living your best life. But brain and pain, those are two of the biggest things. Boy, when the brain's not functioning right and when we're in pain, those are big anchors on our progress through life and our quality of life. And a few adjustments just to get the ball rolling, possibly coming in to see Mychal for that, just as the entry point, take advantage of his giftings.
All right, we need to run. That's a great idea. Now, how do people get a hold of you or come see you, Dr. Meyer or Mychal?
Yeah, it's 712-339-6024. We're at 3305 Berquist Avenue in Spirit Lake, just off Highway 71. Again, we've got an amazing team. We've got something very unique here and very special, and we're very grateful for the opportunity to work with you. And whether or not, I always say, if you want to go slow and that's your pace, that's fine. We're here for the journey with you. At whatever pace is comfortable for you, it may be you're ready to just go all in. So wherever you're at, we'll meet you there, and we're going to give you lots of important tools to help you living your best life. And give us a call for a discovery call if you want me to do a complimentary 15-minute visit to talk a little bit about what's going on with you and seeing how we can support you and if we're a good fit moving forward. If the time is right, give us a call again at 712-339-6024. But we continue to grow, and we continue to bring new offerings and perspectives. Always learning, Dave. We are always learning.
Absolutely. Dr. Meyer, always a pleasure. Mychal, thank you for your time. Both of you have a great day. We'll chat soon.
Be well. Thanks.
Yep. Thanks, Dave.
Dr. Bradley Meyer and Mychal Sheridan from the Okoboji Wellness Clinic today. You can also find out more at okobojiwellnessclinic.com.